Welcome to iMed, which is a favorite program when it comes to health concerns. So today we are going to discuss about a continuation of our previous topic and even moving to a different aspect of our population. So when it comes to our age, elderly people are concerned the most. So elderly people means we specify a certain age limit, and above that we consider them as elders. And when considering elders, what we stress with our today's program iMed is that we should stress their health concerns and we should advise them and we should pave the way for their successful well-being to prevent from diseases. So to do the honors today as well, we invited Dr. Priyankar Jayawardena to our studios. Thank you very much, sir, for joining with us. A specialist physician, Dr. Priyankar Jayawardena, will be doing the honors with us with today's program when talking about the elderly people and what we should know about the health of the elderly people. And sir, as an initiative, let's explain what the elderly population is.
Yeah, elderly population is most of the countries considered as more than 65. But we know that in our country, more than 65 people, they are very active and working and contribute to the society. But when it comes to the medical problems in elderly people, they belong to a different category.
Right.
The social life is different. Medical aspects are different from young people, and the medicine what they take is different. But the common thing is the lifestyle changes, which we discussed even in the past, is same as the young people.
Right.
Social means when somebody is 65, most of the time he is a retired person. So somebody who had a very responsible job in the government sector or private sector and honored by many people, and after 65, you know that he's retired. Maybe that if he goes back to his same place where he had maybe the top post, he will stop at the security guard, maybe the clerk, and ask, who are you? And so that then we have to understand his psychological status. The people who have who are retired, they have different kind of psychological status. Second thing, when somebody is in that age group more than 65, they expect social problems, financial problems. Some people who were young, when they were young in 50s or 60s, and they have given their wealth to their children, and when they come to 70s and 80s, they may not be as rich as when they were young. So that means given money to their children for their education, dowries and weddings. So when you see a person with in that age group, we have to concern about the financial situation. Then the other thing, we have to be very careful. There's a thing called bereavement. When we school days, then we get married, and then the children, and most of us, then one has to go first. So elderly people, after 50 years of marriage life, if somebody, if the partner is left, then we have to think about their mental status. And they are not as fit as those days. The people who were young, and then when they were young, they were driving, cycling and running. And when they come to 70s and 80s, they may be having problems with the balance. Then we have to consider those social and economic and psychological aspects, and they are bit of the mood is not good and sleep is not good. So elderly population is a different population.
So when it comes to that explanation, we consider the society, the economic status, and the medical issues, and even the psychological issues. There are many things we have to consider about the elderly population. And so when it comes to that explanation, and the ordinary practice is that the elderly population a burden to the society.
Well, it's like this. They have done their duty to the society, and they have done their duty to the country, and it's our duty to look after them. That's the primary.
Primary thing.
But we know that the population changing now, and the people don't produce many children now, maybe one or two. So the children, the young population is getting less and less. On the other hand, people tend to live long, though not like those days. Those days people died with a heart attack. Now it's not like that. We put a stent and maybe bypass, and they live up to 80s and 90s without any problem. And if they're having a problem with balance, we give something. If they're having problems with the heart, then we do a bypass or put a stent. And if they're having a problem with the heart rhythm, people get a machine, what you call pacemaker. And if they're having problems with kidney, then kidney transplant. So people, with the advancement of the medicine, people live long. And elderly person is expensive. It's not like in a child, maybe school going child or young man, maybe having a cough, and the illness they can get is a cough and cold and fever. Giving bit of paracetamol or chlorpheniramine is adequate. But think about an elderly gentleman who is in 80s with high blood pressure, diabetes, cholesterol, stroke, kidney problem, lung problem, and the osteoporosis, and the amount of medicine he needs. So those are expensive. So having an elderly population is a cost to the society, which we have to tolerate. So when we consider the advance of the medicine and people live longer than those days, our economic situation should be strong to look after them. Other thing, the social situation, like developed countries, they have age-friendly cities. Then elderly people, they have easy access for buildings. They can go by their own wheelchairs, and easy access for transport. So those things are not there. But we don't have those facilities in many places in our country. So those are the things which we have to consider when we are getting elderly population. And in South Asia, we are one of the fastest aging population, because our literacy rate is high. People free health is there, so people live long. So there's as you said, there's a health aspect and there's a economic aspect as well.
So when concentrating on the health aspect, and we have to consider much about the health of those elderly people, and like if we have our elderly parents at our home, and if we are well known to some of the elderly people, what can we advise them with their health, sir?
Well, we have to understand, as I mentioned, when somebody is getting older, they can get medical problems, almost all the systems. Start from the brain, they can get kind of maybe what you call Parkinsonism, slowness of the brain. They may get a stroke. They may get a memory problem. Then problems with the eye.
Vision impairments.
Then problem with the mouth, maybe taste and gum and things like that. Then problems with the lungs, heart, liver, kidney, muscle, bones and joints. So we should know that when parents complain about certain things, it may be very genuine thing. Only thing, we have to analyze those things very carefully. So people tend to go various doctors. One doctor, they will see a heart doctor, lung doctor, kidney doctor, maybe somebody for sleep or mood, and rheumatologist for joint problems. So when somebody is having multiple medical problems, and if they see many doctors, it's very important to have a kind of a communication like thing about their medicine and medical problem. Otherwise, what will happen? The medicine given by a heart doctor is not good for the kidney. And the medicine given by the rheumatologist may not be good for their liver or stomach, or they may get kidney problem. So other thing, that if somebody is having number of prescriptions by many doctors, there could be interactions between medicines
also.
But I mean that if one doctor can give a medicine for heart, it is not good for one organ in the body. On the other hand, two doctors they have given medicine, and these medicine could interact and could do harm to the patient. So it's very important. We doctors have to understand that there's a possibility that this gentleman or lady is having multiple medical problems, and maybe seen many doctors. And so it's important to go through those things and try to minimize the number of medication. Otherwise, the patient there will be a big disadvantage to the patient. We see lots of polypharmacy in our country, especially among the elderly people.
Right. So when it comes to that communication between physicians, how can we perform them as ordinary citizens? Like for an example, sir, like if one of our, like a well-known elderly person is suffering from a heart disease and numerous types of other diseases, when we accompany him to a doctor, the doctor prescribes medicine, and like we are not aware about the other conditions, and once he get another disease, we're going for another physician, or like is there, like what is the good practice when it comes to that interchange? Because like as ordinary individuals, we might not know what the medications are, how they contraindicate such things. How can we communicate that thing and manage that thing, sir?
Yeah, in developed countries, what they usually people go to their family doctor first,
right?
And the medicine and medical problems are in their system, maybe computer, whatever. Right. So the family doctor organize the other subspecialties. Right. So very unlikely there is a problem with the medication because it is indicated in their system. But unfortunately, we don't have it. Another thing, some patients, they don't tell the other doctor that he or she is going to another doctor. So better not to do that. Right. So you have to tell, I'm going to these doctors, and these are the medicine given by those doctors, and try to minimize the number of medicine because they are the brain and heart and lung and the kidneys and liver. Those are not very young, so may not be able to tolerate all kind of medicines because these medications, they do have side effects. So the patients and the family has to be very open about the medical problems and the medication they take and the doctors they visit. And it should be a kind of a discussion among the patient and the family and the doctor to see what is the final prescription for that particular patient.
Right. So with that explanation, sir, in developed countries, they have the family physician and he coordinates all the stuff like how to visit the doctor, and like sometimes he advises the patient. But like when it comes to the ordinary practice, what we are hearing is that, so like if he or she has some, like he can't see objects, he himself decides that I'm going to visit an eye surgeon. If like his chest is paining, might be a certain muscle pain, but he's visiting a cardiologist. Sometimes like the person himself decides to which specialist physician that they should visit. Is that a good practice, or is there any consequence with regard to that? Because with our previous discussions, we come to know that with kidney issues also there might be certain other high blood pressure or low blood pressure, whatever it is, there might be certain changes. Is it good for us to decide which specialist physician that is best fitting, or is there any better mechanism?
Well, there's a good aspect and the bad aspect. So if you go to a developed countries, and they will say that our problem is we are stuck with our family physician. It's very difficult to get a appointment with subspecialty, maybe cardiologist or neurologist. That I have to wait for 3 months and things like that. But in our country, we can go, and the doctors. I hope that the charges are comparing to the other countries not very expensive.
Yes.
So they could see somebody. And so there's a good aspect. If they have any doubt, they don't have to wait, and if they can afford, they can go and see a specialist doctor. Important thing is to understand that have a kind of a good communication with maybe the family doctor or those other doctors to give the list of medication they take. Then they will consider those things and they will minimize the number of medicine prescribed by that particular doctor. Otherwise, without knowing that particular patient is, maybe that the patient is seen by a rheumatologist and come in with the chest pain, and the cardiologist think it's not a heart pain, it's a muscle pain. So if he is not aware that the patient is going to a rheumatologist, he might give a painkiller or a kind of a medicine which is related to muscle pain or arthritis type of pain. It is already in the patient's list. By another doctor. So the culture in our country, visiting a doctor means that patient think that he should give some medicine. I think that has to be changed. The patient is going to see a doctor for an opinion, whether he is having any problem and whether he needs any medicine. In that case, what are the medicine he takes, and it should be the minimum number of medication, and the patient has right to know why it's given this medicine and what are the important side effects of those medicine and how long he has to take those medicine. But in our country, people think that they should go to a doctor and get the medicine as much as possible, various types of medicine. So if we can change that attitude, means that you are going to see a doctor just for an opinion. If I'm going to a doctor, check my blood pressure. If the blood pressure is okay, then that's fine. I am going to a doctor, evaluate my chest pain, thinking that it's as you said, heart pain. And if the doctor says it is not heart pain, then that's fine. So the paying a doctor doesn't mean you should take should not take additional medication. Maybe that it is unnecessary.
Said that this is not a big pain, but it's severe to me and the doctor can't understand the pain. I'm the one who is suffering with, like, the psychological state of the patient. Like, we have to consider that thing. And in that sense, like, people try to ask, sir, can you please prescribe some medicine, because he needs medicine. In that scenario, what is the better practice, sir?
Yeah, first thing is the explanation. Why this pain comes. It could be something important, like maybe arthritis, maybe cancer, maybe infection. So you have to explain. If it is not a serious thing, then obviously we have to comfort the patient. So that is still then what are the medicine which can give minimum number and minimum period. Because some people, if we take painkiller for a longer time, then they could come with a kidney problem or gastric problem. So then you have to give another medicine. So it's the understanding and the discussion is the most important thing. If the patient is having some kind of discomfort, pain, or sleeping problems, or any kind of a disturbance to the life, obviously we have to give medication. So there's no doubt about it.
No doubt about those things. So what we should consider is that if we deal with elderly people and if they are suffering from a particular disease, visiting a physician is not having medicine or demanding medicine, but it's the opinion of the physician or the specialist physician or consultant or our family physician. It's our opinion that we should get from the doctor in order to lead the successful life. That is not simply each and every disease needs medicine. The doctor might consider that this disease need medicine and this not. So we have to go ahead with that advices. Otherwise, like getting every medicine, each and possible medicine will do a harm to our specifically the functioning of the body. And so, like when it comes to certain practices, elderly people, they say that they have numerous types of experience, and like I have visited the physician many times, and this is the medicine that the physician gives, and they try to become their own physicians in normal ordinary sense. So having those types of medicine will, like, that is very bad to our body. So as a physician, how can you advise the general public taking medicines without medical prescriptions, and especially the elderly people?
Yeah, important question. The thing is, sometimes say somebody comes with tummy pain. So initially doctor might think it's a gastritis or something. But think about a big medical problem, maybe a tumor or cancer. Initial stages, it's very initial stages, it may be difficult to diagnose. So the first doctor might think this is a gas problem, gastritis or something similar to that, and he has given some medicine for 1 or 2 weeks, and he expects that the symptoms to be subsided.
Subsided.
If the symptoms is persisting, then rather than continuation of serving medicine, he should see a same doctor or another doctor and reconsider it.
Right.
Especially if the same symptoms going for months and months. So initially it could be the early symptom of big medical problem. Subsequently, maybe when time comes, maybe 2-3 weeks later, the symptoms might change and the situation could be different. So most of the time what will happen, they go to a doctor and given some simple medicine, continue it for months, and comes with a kind of a cancer or a tumor which is not treatable maybe after 6 months or 1 year. So if the symptom is not settling, it's a good idea to reconsider it, revisit it. Other thing, it's very difficult. Old age, sometimes old lady might complain that they have a problem with taste or difficulty in swallowing. Then we think initially we think it could be something related to the age, but we are considering in our mind it could be a kind of a problem with metabolic problem. Maybe sodium is low, calcium is high, or it could be some tumor, or it could be related to some medicine. So when they come for the first time with some symptoms, we can't go through all kind of investigations. We take some rational, sensible decision. But old age, we have to be very careful. Certain symptoms, maybe that the taste is problem, swallowing is a problem, appetite is a problem, weight loss could be a problem. Initially, we think it could be related to the age, but doctors, they keep in mind that it could be something else. So they first visit or maybe the second visit, they might do certain investigation just to go through it, because as soon as they come, they can't do all the investigations from head to toe. It's not fair. But if the symptom, if the complaint is not settling, it's a good idea to revisit and do necessary investigation just to make sure things are safe, because when it comes to advanced medical problem, it's very difficult to treat.
Right. So the person who is going for a doctor, the first time the medicine prescribed might relieve the pain, or the pain if not subsided, we should revisit. So the revisiting a doctor does not mean that the medicines are not effective, because like when it comes to a certain disease, symptoms, there are few symptoms that we ordinarily practice, and what we say to the physician should be crystal clear about our health condition, and he will determine what the condition is. And sometimes it's difficult to diagnose the initial stages of an existing condition. So what you have to understand is follow the medication, follow the advisors, adjust the lifestyle and proceed, so that you will be able to identify the real problem if there is any, and if there are any consequences with regard to those things, follow with proper investigations. Investigations might be expensive, but nothing to do, because the physician himself tries a lot to cope with the thing without going for deeper investigations, which is much more expensive. With his practice and expertise, he will be prescribing you the medicine, but with proper investigations only, you will be able to identify the real thing that is underneath your body. So with that wonderful explanations with Dr. Priyankar Jayawardene, a specialist physician, we talk about the elderly people, the elderly population, and what we should consider about the health of elderly people, which is a timely, valuable and an important area that we used to discuss in IMED. So thank you very much, sir, once again for joining with us with our today's program. And with IMED, we're discussing many more issues, health concerns, and giving you advices to lead a successful, healthy life, to maintain your proper well-being, health, physical and mental, sometimes which affects the spiritual well-being as well. So thank you very much, ladies and gentlemen, for watching us. Stay tuned with IMED. Have a pleasant day.
Necessary, and it could be harmful even.
Harmful even. And so like what we consider is that the psychological states matters. Like people tend to get medicine that they says that I have a pain, and like the doctor